Have been sending in questions about the COVID-19 outbreak, and we're working to answer them with the facts and not fear. Joining us now is Dr. Andrew Carroll, who sits on the board of the American Academy of Family Physicians. Dr. Carroll, good to see you. Thanks for joining us. Here's our first question.
Hey, Mark. Great.
Go ahead. I'm sorry.
Great to see you again.
Yeah, you too. How accurate is the COVID-19 test?
So that test, in the beginning, we were concerned about the accuracy because it was fresh and new. And now that we've been using it a lot, we think that the accuracy is between 80 and 95%, meaning that if you have COVID, that we're going to tell you you have COVID about 80 to 95% of the time. It really depends on where you are in your illness. If you're really, really early, we may not pick that up. But if you're 7 to 10 days, you're starting to have symptoms, the accuracy is much better. And so we're pretty confident that most of the time, about 90 to 95% of the time, we're going to tell you you have COVID when you have COVID.
Okay, our next question, can I get the flu and COVID-19 at the same time? Because we know when we go back into October, November, the flu will return in some form.
Yep, you sure can, and that's the big concern, right? So if you are particularly at risk, so like if you're a diabetic or you have COPD or some other illness, please make sure that you get your flu shot as soon as possible. We start giving them out in August. As soon as you know that they've hit your doctor's office, make sure you're getting them, because you can get flu and COVID at the same time, and man, you would be sick and you could possibly die.
Yeah, no one wants that. Doctor, the final question. Our air conditioning is on full blast right now. We're in the triple digits. It's going to be this way for the rest of the summer. Can you get the virus through air vents?
Very unlikely. So you remember that the air vent is blowing air towards you. So unless you've got someone in your ductwork with COVID coughing, you're probably not going to get COVID into your lungs. And hopefully most places, especially stores and restaurants, are going to have air filters that are bringing the suctioned air in and filtering that out. So if you're in your own home, it's unlikely that you're going to get it from your own vents. So I probably would say that's safe.
All right. Dr. Carroll, as always, appreciate the heads up and the information. There's so many questions, and you provide such great information for us. We appreciate it.